Liz and I were giggling about the title because she wanted me to talk about frailty and exercise and why it's important for falls and fitness. But we ended up just saying, let's talk about F-words. Because when I go out and I see people at home, when you say falls or you say frailty, they kind of glaze over. They don't want to talk about it. But there's lots of words that we do actually need to talk about in order to prevent falls. Now, I don't know how to use this. Oh, perfect. So these are the figures. These are why I'm here, and I have to put that slide in because otherwise I'm not allowed to come and talk and claim the fact that I'm at work to do so. So it says 1 in 3 people over the age of 65 fall every year, but if we put our hands up, there's probably 1 or 2 of us in this room today who's actually fallen over. So it's not only 65-year-olds who fall over, it's all of us. We've all got that potential to trip, to slip over. And generally we say that we've blamed it on the cat, or we've blamed it on the pavement outside, or it's not a problem. And it isn't a problem to us, because most of us can get up off the floor, we can dust ourselves off, we haven't injured ourselves, and we carry on our way. But probably 5 or 6 years earlier, if we'd been in the same spot, we wouldn't have tripped over, we wouldn't have slipped over. So it's kind of thinking, what's going on, what's happening to our bodies, why haven't we got the same balance? By the time it gets to 80, 1 in 2 people over the age of 80 would have fallen each year. And in hospital at the moment, generally, and I'm going to say Lymington Hospital because that's where I was last week, every single person who is currently in Lymington Hospital has had a history of having had a fall. They're all there, and at the moment, because of COVID, the average age of the person in Lymington Hospital is actually coming down from 82 to more about 65. So it's quite scary. People are getting younger being admitted into hospital, where it was the fact that you had to be quite old to be admitted. Now, 25%, 10 to 25%, depending where you are in the country, of ambulance call-outs, and £115 is just the basic call-out, where they come, they look at you, they do something, they patch you up, then they go on their way. If they actually convey you to a hospital, the average call-out for an ambulance can be about 100, up to over £1,000, especially if there's a long wait in the queue outside Winchester Hospital. So it has a big impact on money. And as Paul was saying earlier, if we spent that money on preventative and exercise and doing more movement, we'd be in a much better place. And that scary figure about 1 in 4 people who have a hip fracture dying within a year. Haven't put about the fact that 2 of those 4 people won't actually go home to their own home, they'll have gone to a nursing home. Fear of falling. These are the people that when we go out and see them because they've had their first fall, if they're frightened of falling again, they're the ones that are going to restrict what they're doing. They're the ones that are going to make their life smaller. Most first falls happen when they're out and about in the community. Subsequent falls happen inside the home. And the falls which generally result in people having a hip fracture and being in a hospital is about 50%. So fear of falling makes people stay at home, makes them less able to do things, less able to go out, and more likely to become frail. And frailty is something that we talk about a lot. How can you then not do something? Oh, they're frail, they look frail, they don't look particularly well, one puff of wind and they're blown away. And you can see on the categories, and I'm hoping at the moment that I'm at least a category 2 because I've got no active disease, but I'm not as fit as I should be, so I can't say that I'm very fit and that I'm motivated to exercise regularly. I know the facts, I know that I should be doing at least 150 minutes a week of moderate exercise, but I don't actually quite fit it in. I'm moving more, but I need to get better, because otherwise I'm looking at a future of ill health. So have a think about where you are on that scale and where you'd like to be. Now, I love this slide, and I have to say that when I showed my colleague Jill the PowerPoint presentation yesterday and said, what do you think, have I got it in the right order? She said that this slide had an impact on her. It made her go for a walk because she doesn't want to spend her life being poorly, because we look after lots of older people. So she went for a walk today. Now, I'm going to say about my father-in-law, because he's 76 years old, history of falls, been diagnosed this year as having heart failure as well. He's quite poorly with it at the moment. And in the last week, I've spent 2 hours assisting with different things. I spent half an hour sorting out his tablets before I came out this evening. I spent half an hour yesterday going to the pharmacies and picking up prescriptions, having a chat with the pharmacist over the counter because he's on a diuretic now and it's made his mouth dry and he's been advised not to drink as much, and it's like, what can he have instead? We spent half an hour cutting his toenails on Monday because he can't reach them. Nice foot massage, it was a nice time that we spent together, we had a good giggle about it, but it's still something that he couldn't do for himself. I spent probably an hour doing the jobs that he would otherwise have done himself a year ago, such as hanging out his washing. I'm making the cups of tea at the moment, whereas 4 months ago, I'd get a knock on the window at 11 o'clock and a cup of coffee handed to me whilst I'm sat down having my meeting. It's really had a big impact on the amount of time that the whole family has because he's got ill health. Even more time it took us last month with all the hospital appointments travelling down to Southampton. And this is the thing, if people say that we haven't got time to exercise, you're going to need time if you've got ill health because it takes hours. We had 150 minutes. How many minutes a day? They said 3 minutes, 30 minutes exercises. I haven't got time to fit it in. But actually there's 24 hours in a day, which is, if I've done my maths right, 160 hours a week. We're generally only asleep for 8 hours of those, so we've got at least 16 waking hours a day in which we can get our movement in. And this is what we need to be doing, is moving more, being more active. And you've actually sat for quite a long time, so do you mind just having a little stand up, having a little stretch?
Have a wobble.
Have a wobble.
Wobble, everyone.
Have a wobble. Have a stretch.
This is
Yeah.
something.
And it's just waking up the body, having a stretch, taking those opportunities. I really don't like the fact that we have remote controls for our TV. Prior to remote controls, you used to get up in the advert, you used to walk across the room, you used to bend down because always the knobs were at the bottom, and you had to turn the telly over. I'm sure that's one of the reasons why.
You had 3 channels, I mean, you've got 200 now.
I know, and you're exercising your thumb, but you're not exercising those muscles to get up and out the chair. Lovely, have a nice little seat as well. And, including activity, how do you make your day more active? Now, they recommend, isn't it? Sometimes you look at one app and it says 10,000 steps, other ones it says 9,000 steps. It's individual to what you need to do, but it's kind of sort of like thinking, what do I do now? And how actually can I make myself more active? How can I make myself move more? And when I'm going out to visit my patients or the carers that, when you go out and do your visits, don't answer the door to them. Don't let yourself in. Try and get them to answer the door to you, to let you in the house, because then you know they're moving. So, more movement. So, functioning well. Some days I function really well. I'm like Superwoman, I can do absolutely everything. And other days, even getting out of bed is an issue. Cleaning your teeth and brushing your hair and making sure that actually you've got your name badge on the right way up. It's an issue. But this is one of those ageing tests for younger people to do. Can you actually get down on the floor, doing the wash your feet method, and then get back up? We're not going to practice that today. That's something for you to practice at home in your own time. But this is something for the past 4 months I've actually been trying because I couldn't do it. I couldn't do it. When somebody said to me, can you do it, they challenged me to it. And 4 months ago, no, I couldn't. I needed to use my hands. Some days, when I'm Superwoman, I can do it. Other days I can't. Now the version for older people is the backward chaining. It's a bit blurry, but that's my test for my older people. Can they do that? If they go out and I see them and they've had a fall, I want to know how they're going to get up from the floor. What's their plan? Is somebody going to come and help them? How long would they be on the floor? Would they be there 3 days before somebody comes and gets them? That's what I need to know. So that's my, can you function well enough to get up from the floor? And if you can't, have you got a plan to get up? That's what I aim for when I talk about people. This is why you need to get more active, why you need to move more. So you don't fall in the first place, but actually if you do fall, you can get up. Will this work if I use the button for the YouTube
Maybe
video?
there is one place, I believe.
Orthostatic hypertension, OH, causes a drop in blood pressure on standing upright. It tends to affect older people or people with chronic diseases. A doctor or nurse can calculate how much the blood pressure drops simply by checking the blood pressure, first while lying down and then while standing up. Many people will respond to simple treatments, but for the chronic cases of OH, there is no cure at this time. As gravity pulls blood down into the legs away from the head, our bodies usually detect the drop in blood pressure, squeezing the blood back up towards the heart so that blood pressure can be restored. In people with OH, the body is unable to do this, so blood continues to pool in the legs, which often causes dizziness and lightheadedness on standing. There can also be some other non-specific symptoms, and in severe cases, it can cause falls and fainting. It tends to be worse in the morning or when getting up during the night, so take extra care when getting out of bed. There are some easy actions which those with OH can take. Always stand up, slow, safe, and staged. Don't become dehydrated. Try not to get too hot, as heat lowers blood pressure, and also try to avoid alcohol and large meals with lots of carbohydrates, because they also both have the same effect. Review your medication with your doctor or pharmacist, as many medications can cause or worsen OH. Other things which can really help include drinking plenty of water, which can work positively like a drug, with each large glass of water being absorbed through the gut, entering the liver and stimulating blood vessels to squeeze blood back towards the heart, raising the blood pressure. Muscles can also work just like the heart, pumping blood around the body. Squeezing the muscles of the legs and buttocks help to pump the blood that has pooled in the legs back up to the heart. This technique can be used when standing up to relieve symptoms. Sometimes compression stockings or medical corsets are used to stop blood collecting in the legs and pelvis. In some cases, medication may also be used to increase blood pressure. A few people with OH may have low blood pressure while standing up, but high blood pressure while lying down. As treating one may worsen the other, these people will usually need to see a specialist to find the right balance between treatment options. Clinicians and academics are continuing to research OH and its treatments. More information and advice will become available as research continues.
There is one thing that treats it quite nicely. Any guess what it is? Exercise. Yeah? Exercise treats it really nicely. I show that slide, that little YouTube video when I go out to see people now, because they don't remember me telling them about what their blood pressure's doing when they stand up. But they do tend to remember that I was the nurse that showed them the cartoon. Works. You ought to be on Adelaide surgery, you know, on the thing where it comes whizzing round.
I get rid of patience.
Pardon? Yeah. Paul said I might talk about osteoporosis. It's one of the things that I very often talk about people, in fact, that the main risk of falling as you get older is actually if you do fall and you break something. So I get them to have a look at what their FRAX score is, and that's their 10-year risk of having a fracture. So get them very simply, you can Google it, put in the UK version, put in your age, put in your height and your weight, and then just go through the questions and it tells you about the risk. And then if you press the next button, it tells you whether or not you need to actually be treated with medication or whether or not actually you need lifestyle advice. What's the lifestyle advice? Have a guess. Exercise, vitamin D and calcium. So that's a normal bone, and this is your osteoporotic bone. So landing on a wrist, which is osteoporosis, when we fall over, we reach our hands out to save ourselves. And a lot of women at the age of 50 and 55 have a fractured wrist because actually they're already osteoporotic. Partly that's to do with the age that they reach the menopause. 70% of it is down to the genetics of the bone health of their parents, but 30% is down to diet and exercise choices. So if you're at risk of a fracture, you need to be exercising. And this gives you the lifestyle, regular weight-bearing exercise. And even people in a wheelchair, we can get that weight-bearing exercise in either by your assisted machines or by using TheraBands and targeting. So targeting the wrist, targeting the back and targeting the hips. Vertebral fractures, you don't actually have to fall over to have a vertebral fracture. You could sneeze or you could roll over in bed and fracture that way. And one of the ways that we can combat it is actually having good posture, good back care. So I'm going to ask you, can you all nicely sit up in the chair, have a stretch and get a gap between your hips and your ribs and lengthen your spine. Take a nice deep breath in and do that. Lovely. The other thing is to work the shoulders. You carry a lot of tension in your shoulders. So, shoulder shrug up, roll back, try and get the shoulder blades to meet, and roll down. Do it nice and slowly. 3 more times. Shrug up, roll back, and down. And again. So you can do that any time, that exercise. But just straightening up and doing a little shoulder movement like that will improve the blood flow to your spine. A little movement, but if you did that 3 or 4 times a day, it would help your posture, help your bones, and count towards those movement minutes. Fluids. How much do you need to drink? And this varies so much, doesn't it? You need to have 6 to 8 drinks a day. You need to have 2 litres, you need 1.6 litres. If you speak to the heart failure doctors, well, you don't drink at all because it's only going to hurt the heart further, but you still need to keep hydrated. And the thing is aiming to drink 6 to 8 drinks a day, and water is the best thing for us to be drinking. But tea, coffee counts, alcohol doesn't, sorry to say, but you need your water, so make sure you're drinking. And especially as important is that first cup of water in the morning. I had the video about postural hypertension. Actually, a first morning glass of water helps combat that as well. And it helps with coordination, it helps with your thinking, wakes you up for the day. Your food. We're so used to seeing the healthy eating plate, aren't we, and the different things. But I've recently been going over to this healthy checklist of, am I getting enough fruit and veg in my diet today? Am I actually getting my exercise in? Am I drinking? And am I having my dairy products? And if I'm dairy intolerant, or the person I'm speaking to, what are they having as a substitute for that good bone health? So I quite like that one. Footwear. I did this slide, I had a look at my own shoes and thought it's time for some new shoes. It's one of those jobs, I hate going shoe shopping. I like a nice comfy shoe that I can slip my feet into and just carry on walking. But actually my shoes were in the shopping state, so I did go out and treat myself to some new footwear. And you need to have a supportive heel, alternative shoelaces, but very often when we look at the activities we're doing, people aren't wearing sensible shoes. The falls at home where people are doing DIY generally are because they're wearing worn out trainers. Yeah, I'm painting. I'm going up a ladder on the roof to clean the window. I don't want to get my good shoes dirty. Now why would you wear a shoe with a worn out sole to go up a ladder? Doesn't make sense, does it? Now, I've got a nice Skechers shoe here. I really like the Skechers shoes. Now, the chiropodist and the podiatrist that I've been working with calls them a hug. He calls them a foot hug. But he would ban them because he says they don't provide sufficient support for the ankle and the foot. They do initially, but only if you then don't continue to wear them after 6 months, because of the memory foam in the foot, in the Skechers, will actually take on the shape of your foot rather than support the ankle to do the exercise. So footwear, have a look when you go home, think about what footwear you're wearing and think about the activity you're doing, and also with the people who are doing the exercise, have they got the right footwear? Does it support the right heel? Does it support the foot to enable you to do it? But it's really important as well that we exercise our feet, which brings us nicely onto our next slide. It's a bit blurry, but never mind, that's my fault, not yours. So happy feet, they're the furthest end away from us. If you can't reach them, they tend to get neglected. It's hard work to bend down there. You get people with diabetes, they can't feel their feet anymore, so when they're cutting their toenails, they sort of like cut their feet as well, and then they cause a sore. Or also, they're too hard to cut. So that good foot care is really important. So we know about cleaning them and drying them, making sure that we treat fungal infections, but we also need to be exercising the toes and exercising the feet. So again, demo time 6 strictly. Up nice and tall in your chair, have a nice position. This time, what I'm going to ask you to do is just bring the toes up and then rest them down. Up again and rest them down. Swap it so that you go up onto your toes, lifting up the heels. Great. And you should be able to actually get your big toe, your second toe, your third toe into contact with the ground, and don't turn out the ankles. Lovely. So alternating those as well. So one up, one down, one toe. Brilliant. Bit of coordination work. You can do this whilst you're sat on the telephone or during the adverts. Now that's exercising one way, which is good for balance, but we do a lot of turning when we do things. We turn to sit in the chair. We turn backwards when we open a door or open the fridge. Turn to sit in the car. So you've got to be able to work your feet both ways. So this time what I'm going to ask you to do is just turn your feet out to the side, turn them back in, and then with your heels, turn them out. So you can exercise your feet in each position. And generally this exercise, people find a lot safer. 3 minutes, I can do it. Final one for your feet is you need to have toe grip. Now toes get very stiff as you get older. So the exercise for that is just spreading your toes and then scrunching them up. So you spread them and scrunch them up. And if you haven't got room to do that in your shoes, then your shoes aren't a good fit and you're at risk with bunions, which will affect your walking when you're older. We heard how family can even wrap you up in cotton wool, prevent you from doing things, and going outside, or actually can motivate you to get out and do more. Really important. get out and do things, and not necessarily de-skill people by doing everything for them. Finance, money, costs for a class between £4 and £8. But the cost of a carer is £15 an hour. And you know, to have your shopping delivered, you've got to add on an extra £4 to £7. And people can find that cost, but can't always find the cost to have an exercise. So, the more needs you've got, the more money it's going to cost. So it's that thinking, how actually are you going to sort of like persuade people to spend money on exercise and invest in themselves, which is what you want them to do. And then finally, it's just one with the ferrules, check your walking stick. And I know I gave Anne a couple of ferrules the other day, didn't I? But that's the thing, they're like your tyres. You wouldn't go out on the road with worn tyres, so please check the ferrules on the end of your walking sticks and frames. Make sure that actually they've got a good tread. That's where you can go back and get the information from if you need it, or happy to come and talk to people anytime. But it's up to ourselves to make sure that we keep ourselves moving, but it needs to be fun, because actually if it's fun, we'll engage more with doing it. Okay.